Hello friends, welcome to my channel, Dr. Online 24/7. Today I'm going to tell you about polio. Polio is an illness caused by a virus that mainly affects nerves in the spinal cord or brain stem. In its most severe form, polio can lead to a person being unable to move certain limbs, also called paralysis. It can also lead to trouble breathing and sometimes death. The disease also is called poliomyelitis. Polio can affect your body differently depending on where the virus multiplies and attacks. Types of polio include: abortive poliomyelitis causes flu-like and intestinal symptoms. It only lasts a few days and doesn't cause long-lasting issues. Non-paralytic poliomyelitis may cause a septic meningitis, a swelling of the area around your brain. It causes more symptoms than abortive poliomyelitis and may require you to stay in the hospital. Paralytic poliomyelitis happens when poliovirus attacks your brain and spinal cord. It can paralyze the muscles that allow you to breathe, speak, swallow and move your limbs. Depending on what parts of your body are affected, it's called spinal polio or bulbar polio. Spinal and bulbar polio can appear together, bulbospinal polio. Less than 1% of people with polio get paralytic poliomyelitis. Polioencephalitis is a rare type of polio that mostly affects infants. It causes brain swelling. Post-polio syndrome is when symptoms of polio come back years after a polio infection. Who is at risk for polio? You're most at risk for polio if you aren't vaccinated and you live in or travel to an area where polio hasn't been eliminated. Live in or travel to an area with poor sanitation. Are under 5. Are pregnant. Is polio contagious? Yes, polio is highly contagious. It spreads easily from person to person. How is polio diagnosed? It is diagnosed by performing a physical exam, testing samples of body fluids and asking you about your symptoms. It's important for your doctor to know if you've traveled anywhere recently. Samples of body fluids are taken to look for signs of polio or other infections, including spit, saliva, from your throat, poop, stool, blood, cerebrospinal fluid, liquid around your brain and spinal cord. Because polio symptoms look a lot like flu symptoms, your provider may do other tests to rule out more common conditions. This is all about polio. Hope this video is beneficial for you. Thanks for watching my channel, Dr. Online 24/7, by Dr. Sana Bawani. Don't forget to like, share and subscribe my channel.